Micro-incision cataract surgery, MICS, is defined as a type of cataract surgery that can be performed through incisions of 1.5 millimeters or less, improving surgical efficiency. MICS requires special micro-instruments to perform the surgery. The advantages of MICS over coaxial phacoemulsification have been recently published by us concerning the control of astigmatism and more efficient surgery, significantly decreasing the effective phaco time. Here we present a new instrument, the MICS Stinger. Mother Nature uses the principle of pointed, curved, hard, natural devices such as the beak of an eagle and the sting of the bee. The sting is not only used to attack, but also for other functions in nature. We have incorporated this principle into our MICS irrigating probe, which includes a large, inferiorly oriented irrigation hole, together with a curved, pointed tip. This is the delicate irrigating MICS Stinger. Following the example of Mother Nature, the sting is at the end in order to allow the surgeon to perform multiple aspects of MICS surgery. We have investigated the irrigating flow necessary to maintain the fluid balance during MICS. This fluid balance is based on the downflow of the fluid towards the capsular bag, which improves the control of the surgeon during MICS phacoemulsification. The irrigating capabilities of this instrument are unique and offer a potential of intraocular irrigation of 76 cc per minute, the largest of any MICS irrigating probe. Let's see now the unique features of this delicate and useful instrument. MICS starts with the execution of 2 stab incisions 90 degrees apart, located in the positive and negative meridians of the cornea, to induce a neutral influence on the astigmatism. Using the specific MICS instruments, capsular hexis is performed, followed by hydrodissection and clippage of the nucleus. The MICS Stinger is now on the stage. It penetrates the eye more easily due to its ergonomic design. An incision, calibrated to 19G, avoids leakage from the interior chamber. The Stinger helps the MICS phacoemulsification tip with nucleus cracking during the different stages of surgery, as seen here. MICS enables the separation of fragments during the procedure with large and hard nuclei, showing here very special features. The management of hard nuclei is significantly improved by the use of the MICS Stinger. The subdivision of nucleus quarters and the manipulation of fragments inside the eye are performed, together with maneuvers that make the large fragments rotate, enabling further dissection by the MICS Stinger. The MICS Stinger helps in soft, medium and hard nuclei. MICS Stinger helps in soft fragment manipulation, always maintaining the balance of fluids inside the eye during the most difficult maneuvers. For these maneuvers to be effective, the stingers should always be located lower than the phaco tip, improving the expansion of the capsular bag and making MICS surgery safe during fragment removal. MICS Stinger assists the aspiration probe and avoids blockage of the hole during the aspiration of masses and cortex, as can be seen in this image, allowing the surgeon to use either hand for this maneuver. The Stinger assists the surgeon to look for masses and fragments inside the capsular bag or underneath the iris. The stinger is especially useful in small pupils, as the pupil can be stretched and handled with care with the delicate tip of the stinger without altering or damaging the iris border. The stinger helps and improves bimanuality during Mike's surgery. One of the key features of this unique surgical technique, which is an evident advantage over coaxial phacoemulsification. The refinement of bimanuality is achieved with this instrument. Mike's stinger allows the implant of Mike's IOLs without the use of viscoelastics, as can be seen here in this image. Whilst keeping the capsular bag wide open, the cartridge is inserted inside the cornea but does not enter the eye, allowing, with this maneuver, implantation of the IOL through the smallest incision possible. The Mike's stinger is particularly useful in viscoelastic removal, thanks to the delicate, pointed tip of the instrument. Mike's stinger guarantees an adequate fluid balance during Mike's surgery. Mike's stinger is a gentle, multifunctional instrument that refines Mike's surgery, improving and using devices that are used by Mother Nature in order to enhance the performance of the cataract surgeon during microincision cataract surgery. Mike's stinger is better than any other irrigating probe, with the added advantages of multifactorial use that makes the use of other aggressive instruments unnecessary, especially choppers. We kindly suggest that you learn how to sting the cataract with Mike's. Thank you.